honestly.
Okay. So, if I am going to be the one picking, I'm not going to do your ribs because that's insane considering they move, right?
Mm-hmm.
So we can do a hip or we can do a shoulder.
Probably the shoulder would be best.
Okay. Would you prefer left or right?
Probably my non-dominant one.
Which one's that one?
My left.
Your left. Okay. All right, let me go. That's right. Let me go get a mask. Get her hooked up to an IV, Benji. Get the oxygen mask on her. Get her out. She's not going to be awake for this. And then I need you to push. You're light, right, Arabella? You're like what, 100, 115?
100's probably a safest bet, yeah.
20 milligrams spent.
Okay.
No. No, not Fent.
Why not Fent?
Because I'm fucking allergic to it.
I thought you would be allergic to the non-synthetic opioid.
Well, the one that was put into my arm when I was fucking tortured was the one I'm allergic to.
Ah, okay. Well, we'll wait for Kia to get back then. I'll set the IV up, but I won't push any Fent or anything that will knock you out, so it can be a conversation. Right, you're gonna feel a slight pinch. It's just gonna be some fluids for now. Apparently, Arabella said she's allergic to fentanyl.
You're allergic to a synthetic opioid?
Apparently.
When's the last time you had Fent?
3 weeks ago?
Okay. You had anaphylactic shock?
More like a rash.
A rash.
Mm-hmm.
Okay. Where was the rash?
Where it was injected. Yes, injected.
Okay. It wasn't done with an IV?
It was done by Nico.
Nico.
The fucking person who did this to Lena and I.
Oh. Okay, and we're sure it was Fent and it wasn't something
That's
else.
what it was on my toxicology.
There wasn't anything else on your toxicology?
Nope.
Are you allergic to hydromorphone?
I don't know.
Well, okay, so here's
Fentanyl's
my
the only thing that was on the fucking, like... I don't know what kind of fentanyl it was, but you said Fent and I kind of... I don't know.
I can swap to something else. I'm more than happy to do that.
Probably a safe bet too, just in case.
I'm just a little surprised that a synthetic opioid you were allergic to and it wasn't something like on the needle itself that was injected in you. That's my concern. And the other concerns, I can give you hydromorphone. I have no problems with that. Have you had a bone marrow biopsy before?
No.
Okay. This is about as painful as it gets short of a kidney stone and or pregnancy. So I just need to make you aware of that, okay?
Mm-hmm.
Okay. All right. All right, well, we're going to swap the Fent then. Instead of the 20 milligrams, we're going to do 200 of hydromorphone. I'm going to try to keep the pain down as low as I can for you, Arabella, when you wake up, but it is still going to hurt, okay?
Okay.
Okay. I wish I could make it not hurt. I really do.
Let me get all this hooked up.
Okay. And then go ahead and count back from 10 for us, sweetie.
10. 9. 8. can't fucking...
All right. I'm gonna go ahead and go into the left shoulder blade.
Mm-hmm.
We're gonna take this nice big long needle. Yes, watch those vitals, especially because she's coming close to a very high dose of hydromorphone.
Mhm.
I'm just trying to make it so it's not incredibly painful when she wakes up. I'd rather just have it be sore as opposed to sharp. So I'm just trying to make her as comfortable as I can, because that's the important part. I wish I would have seen this toxicology report. I'm very curious about the fentanyl allergy.
Is it not on her medical profile?
Let me check. It is. It's just... Okay. It is. It is on our medical profile. But that's okay. I just don't have a nerve block's not going to do anything for the bone pain is the problem.
Mm-hmm. We've had multiple people come in with it saying they have a fentanyl allergy recently. Maybe it's someone's mixing it with something.
They would have to be. Synthetic opioids are purely synthetic. They don't prompt an allergic response. That's why I'm concerned that maybe someone's mixing bad fent out there.
Yeah, that's what I was thinking.
That's something we'll have to research further, to be honest. We need to get someone, we need to get a hold of someone who has a fent allergy and actually run it against our hospital fent. But that's not Arabella, because of her blood type, because it could be related to that too.
We had a patient recently, something Knightley, I think his name was. Raphael something Knightley. And again, with the amount of people coming in saying what sort of drugs they've found, it wouldn't surprise me people cutting things with things.
Well, yeah, and fentanyl's cut with in a lot of things, and that's what concerns me, right? Is they're cutting it with, you know, cocaine or mushrooms or meth or, God forbid, heroin. That would be awful for everybody.
Luckily, it seems at the moment the popular choices are coke and meth based on everything that I've treated.
That's good. That's good.
In the grand scheme of things, it's not great, but it's better than heroin.
All right, here we go. All right, I'm gonna go into the skin. I'm gonna go ahead and angle directly into the shoulder blade.
You know, watching procedures doesn't normally make me flinch, but the idea of that makes my shoulder hurt.
All right, I'm gonna go in. Are you ready?
Mm-hmm.
Okay. Make sure to watch those vitals, please, especially the oxygen, okay? We're gonna go down into the epidermis here. Oh, our spinal surgery's here too. Ooh, perfect. Okay, we're gonna go ahead and push the needle here through the muscle tissue. All right, I'm gonna go and push it into the bone. Watch those vitals for me. They should spike just slightly.
Mm-hmm.
3, 2, and 1.
Little spike.
Okay, I'm going to grab some of the marrow. There we go. And then I'm going to go ahead and remove the needle. Get that all the way out. Okay, Go ahead and do some iodine gauze pad here and some medical tape. All right, I'm gonna go run this downstairs and check the volume of the marrow that I got. Make sure it's good. Go ahead and get her over to recovery and get her as comfortable as you can. You may need to give her more meds.
Okay. Okay, Nancy, we're gonna go nice and slow and get her through. 1, 2, 3. Okay, Nancy, let's move her into the bed. Hey, how are you feeling? No, she's running the marrow now as we speak, so how on a scale of 1 to 10, how bad is the pain right now?
Three.
It's not too bad at least. If it starts to climb, because it probably will, let me know and we'll adjust the pain meds. Hopefully, at least with this, we'll get all the answers that we need to help make it better, and you won't have to do this again. Is there anyone you want me to contact? Do you want Alex here at all?
How's she doing?
Okay, pain is 3 out of 10 right now, so
Okay, that's not bad.
hydromorphine's
bad.
still doing its job.
That's good. Does it just feel sore, Arabella? Okay. All right, let me type this up and then I'm gonna pull up these results, okay, honey? And then I do kind of want to run a blood test on you, but I don't want to pull blood from you due to anemia until we potentially solve that problem, okay? Because I don't want to have to give you more blood that's already hard to come by.
Yeah, I could only find 1 bag yesterday because I know we had 4 and then we used 2 units with someone else.
I'll get some synthetic on order. We need to keep like 10 to 15 bags of synthetic just because we have so many people with this blood type in the state anymore. We can't rely on donations.
Exactly are you looking for in bone marrow check, by the way?
Yep. Hang on, I'll explain that. Let me get this typed up here, okay, sweetie? Because I know that also just made you tired. Because hydromorphone is a very good sedative as well. And it drops your blood pressure, which you already have low blood pressure to begin with. So that's not helping. Benji, you want to go grab Brett? He's out in the waiting room and get him prepped in OR1.
Yep. Anything in particular you'd like me to do?
The stem cells are going to be in the refrigerated unit. And make sure we have traction applied for his spine because we need to hold that in place while we open it up.
Okay.
Thank you.
Excuse me. Excuse me again.
Okay. What I'm going to be looking for here, Arabella, is the percentage of bone marrow in your less scapula, I should say. I'm sorry. I'm looking for anywhere between 1 to 2%. And then of course I'm looking for about 2% or less plasma cells. So give me just a second. Okay, let me pull out these results here. Let's see what we got.
I didn't quite understand what you said you were asking for.
No, that's okay. So I'm looking for the percentage of bone marrow that's generally present within your bones. It's usually between 1 to 2%. So I grabbed a small sample of that. And the way I'm going to determine that is if the plasma cells in the sample I have is less than 2%, you have a low amount of volume. Or if it's more than 2%, you have a normal or a high amount. And high is not a bad thing. It just means there's another problem. There's a different reason you're anemic as opposed to being bone marrow related. Which is more tests. And I know how much you love diagnostics.
That's right, I'm a walking dummy for diagnostics.
It's all right. Okay. All right. So you're kind of intermediate there. So your anemia might not be tied to the bone marrow, which is good. That's actually good. which means more tests. Hmm.
Going through the
Okay. Okay. You rest here, Arabella, till you feel good enough to get up, okay? And if you don't want to get up, I can get you moved over to Lena's ICU room, okay?
Stay here for a little bit.
Okay. But you're probably not going to be working today. Send it. We're gonna do Fent, but we're gonna add a nerve block to it. Specifically Nimbex. I need him to not be able to move. Okay. All right, you rest here, sweetie. Okay. I won't have you on duty today due to the amount of hydromorphone we gave you. Okay.
So what happened was I was on a boat and then I slid a little bit down, like the side of a
You
cliff.
wanna
And I think I just landed funny.
the crafting thing another day?
Oh yeah, I went up like a
Yeah.
what the fuck is it called? Like a hill? It wasn't a hill.
Yeah. We'll do it another day.
Land bit.
Let's let your body recuperate from that particular test, and we can do the grafting any other time. It's not like it's gonna change anything. I have to cut it anyway. So it's gonna be a fresh wound anyway when I do the graft.
Like a.
Okay.
No, I didn't hurt myself on the boat. It
Okay.
was this mountain.
Get some rest, my dear.
And then climbing uphill and then sliding down said hill again. Yeah. Everywhere. No, it's mainly my leg. My knees. Yeah, little grey, little cuts. Might need to flush it out, you know, some gravel and shit, some sand. Oh yeah, alright, I literally work here. I'm literally a doctor. No, I'm a criminal. I'm a fucking criminal. I love that shit. It's a rush. Yeah, that's me. They used to call me Action Jackson, and then I got married and changed my last name, yeah. No, Holiday is my last name. Holiday! Holiday! Oh, tell me about it. All-inclusive Benidorm? Hell yeah. Trashy. Yeah, I don't care about all... No, I love the heat. Oh, I love the heat. Ooh, yeah, interesting. Yeah, not bad. Yeah, yeah, not bad. Yeah, true, true. Yeah. Perfect, thank you. Ew, infections! Oh, that's fine, totally fine, totally fine. Just, yeah. Yeah. Yeah, that's fine. Thank you, somebody finally agrees. Wow, he's such a good doctor. Yeah, just chop it off. Fuck it, do you know what? I'll get an axe, I'll just do it myself. Yeah, it'll save you the trouble. I know how to sew. Fuck it. Easy. Yeah, I got...
This doesn't feel right actually now that I'm having a physical feel of it. let's get Nancy to do an X-ray. I think I want to take a closer look at that. Oh, my radio's so loud.
I'll back away so I don't get irradiated more than I already have been.
Okay. Okay, so we're gonna have to do a little bit of surgical repair. Which I know is probably not something that you want to hear right now. But if we leave those pieces rattling the way that they are, that's just... it's gonna cause more pain in the long run.
Face and head is walking pain.
I want to try and reduce that as much as I can.
It's killing me.
Okay, so let's take a quick look at... I'm going to check everything first, and then I'll figure out a plan of how we're going to treat it and where we're going to treat it.
Alright.
Let's take a look at that carving, if that's okay. Okay. I probably need to replace the bandages on this.
It said
Okay, before I rebandage this, I'm just gonna give it another cleanup, and then maybe it might need a suture or two. I'll know better when I've got this blood out of the way. If at any point you need me to stop, then let me know and I'll take my hands off you, okay? Okay, that's definitely gonna need some suturing. That is fairly deep. I'm gonna do that now, that way I don't have to keep revisiting this area. Let me grab a suture kit. Does Lena know that he was caught?
She was there after the fact. I called her immediately. Excuse me, texted her.
I'm gonna try, and I don't want this to scar, so I'm going to try and make sure that it doesn't. It might still scar, it might still leave a mark, but I'm going to do the best to reduce it as best I can. Okay, now let's take a look at that bullet wound. Is it more of a graze? Let me just. Am I okay to move your sleeve?
Grab some dumbbells. And grab one dumbbell, hold it in your hands like this.
Apologies. There was a bit of blood there. I didn't quite see that. Let me clean that up.
Sorry, I feel like I'm dealing with arm pain. Give me a minute.
No, you're fine. Take as much time as you need.
It's fat.
Because you had a reaction to fentanyl, right? So I don't want to go there.
They removed. They're reversed. Oh, it's been a little bit since I've had it, so it's still in my system, but not as strong.
Okay, I can do a small controlled dose of that then, of hydromorphone. Alright.
I do have a concussion, so there is that.
Alright. We'll check for... Did they do... I assume because it was a probie, they didn't bother doing any scans, checking your brain or anything?
There is a minor swelling, yes he did, of the head, but that's all.
Ah, okay. I can get some mannitol going as well then.
Okay. It's fucking killing me.
I mean, that's to be expected with absolutely everything that you have been dealing with. Hopefully I can try and remove some of that discomfort. Alright, let me know when that's kicked in a little bit and I'll take another look at that arm, but we'll go slow and take as much time as you need.
One more time, sorry.
I said I'll wait a little bit to let that kick in. When you feel ready, then let me know. Take as much time as you need.
were you looking at for the...
I was just checking the gunshot, seeing if it was sutured, if it needed anything for me to take care of. Okay, gunshots looking... They did a pretty decent job with this. I'm gonna rebandage it. Okay, I'm just gonna take a look at where you was injected with the dilaudid. Is it particularly sore at all, or is it just a bit of bruising?
It's a little sore. He wasn't very careful.
Mm-hmm.
Kind of injected it right into my vein.
Ooh. Okay, I'm gonna just give that area another little clean just to be safe. Hmm? No, it's okay. Do you want me to stop?
It's fine.
Okay.
You said you're gonna talk to Kia?
Yes, I'm gonna see if she'll help me with this surgery because it's an unfamiliar one, and I really do not want to fuck up your face.
Well, good thing you're not the one fucking up my face.
No, I mean, yes, but if I don't fix the nose correctly, then I would feel awful. Okay, like
Nico's the one who fucked up my face.
I suppose that's true. How is that split lip feeling now? Still a little sore? Do you need an ice pack for that?
What? Sorry?
Your split lip, it looks a bit bloody.
I don't know. Kind of just dealing with it right now.
That's fair. Alright. I'm just gonna do a quick check. I think I got everything, but I might have missed something. Then I'm gonna step out and have a word with Kia. Okay, I will be right back. Feel free to sit up, get more comfortable. I know these beds are fucking awful.
Especially
I will
when
be
you
back
lay
in a
down on
minute.
them.
Yeah. Looks like they're gonna bend your bloody spine.
You doing okay?
Not really, but I will be. At least the good thing is he's behind bars in prison now. So I don't have to
Actually, I'm
worry
gonna
about
eat
it
before we
anymore.
start.
Do that.
No. Same. I'm gonna lay right here. Hopefully this bed doesn't hate me. Okay, this bed doesn't hate me.
None of the beds hate you.
Well, actually, the one in the room we were just in puts you on the bed the opposite way.
It doesn't. Yes, that's on purpose.
I
It's
don't
supposed
like
to
it.
elevate. It's supposed to elevate your feet. That's the idea. Okay. All right. Let's get you all hooked up to an IV. Because we are gonna take care of both those carvings at this point. I'm not gonna wait anymore.
No,
You get too many carvings, Arabella.
I'm not gonna get any more. The son of a bitch is in prison now.
Yeah, well, you seem to attract trouble, so I'm just gonna.
You know,
Preemptively.
that's fair. That's fair, actually. That is fair. I can't argue
All
with
right.
that one.
Count back from 10 for me.
10. 9.
There we go.
Yeah, I already had to do a broken jaw surgery today, and that's enough facial surgery solo.
Well, so the thing is with cartilage, it's actually really simple to repair.
Okay.
Because it's not bone, right? So when you're talking deviated septum and when you're talking slightly out of alignment nose cartilage, all you have to do is take away the bad bits and you just let the cartilage repair itself.
Ah, okay.
It's real simple.
I'm sorry for bothering you then. I apologize.
You didn't bother me. I had to cut my date short.
Oh, I'm sorry.
No, it's okay. It's fine. It's I don't have words to describe it.
Is that a good thing or a bad thing?
So okay, I'm gonna get the incision here on her nose. It's a good thing. I mean, we had to cut it short for other reasons. But we kind of came to a consensus right before she left.
Mhm.
So hopefully soon in the future I can actually be open about it.
I'm
She
happy for
is
you.
she is worried about what my employees think.
I think she's lovely.
Yeah, that's fair.
She seems like a chaotic little gremlin sometimes, but that seems to fit in perfectly with the hospital anyway, so.
You're not wrong. You're not wrong.
You deserve good things.
I have a second chance and I need to take advantage of it and I'm not going to let this opportunity pass me by. I'm not.
Good.
All right, so you see here how it's kind of crooked.
Mhm.
What we're going to do is we're just going to straighten it out.
So when I did the x-ray, there was a couple of fragments. Is that still parts of cartilage that have kind of
Yeah.
broken off? Or,
Yeah.
okay.
Yeah, we're just going to remove those pieces. We'll just remove those pieces. Once I get this straightened out and we get a clear airflow along the septum, then we're just going to grab those fragments and we're just going to take them out. We may use just a tiny portion of bone cement just to keep it temporarily stable, right?
Mhm.
We don't really need her nose collapsing in on itself, as funny as that would be. just because it kind of impeded her breathing for a little bit.
It's mean. As funny as I would be. God, I love her.
Just gonna line that up there, make sure that cartilage is straight. Okay, let's find these fragments here.
Nancy, can you turn my phone off, please? Thank you. Sorry.
No, that's all right. Let's go and look at these fragments. You said there were 2 of them?
There was a couple. I didn't manage to count how many on the X-ray.
Okay.
Yeah, I had to do surgery on Trina today.
Oh, what for?
The broken jaw.
Hmm. How did she end up with a broken jaw?
She got into someone got into a fight with her or something.
Why?
I don't know. It was when she was off duty.
Don't tell me she's picking fights.
I'm not sure what's going on.
That's a problem.
I just don't like how many people, the staff or people that I know, I've had to drag into the OR in the past 24 hours.
Hey, congratulations, you haven't had to drag me into the OR.
Don't even, don't. Kia, don't.
Yeah?
Don't.
Okay, let me turn off my pacemaker right now. I'm gonna
I
collapse.
swear, I will quit.
Denied.
You cannot deny a resignation.
Yes, I can. I'm your boss.
Yeah. I'll hand the resignation to Athena.
That's fine. She'll also deny it.
Actually, yeah, you're probably right.
Yep.
Oh, I told Dan to get the fuck out of my OR earlier today.
Really?
He came in talking about Cake and Nancy, and I kind of... Trina was nearly gonna choke on her own blood, so I kind of told him to get the fuck out.
Well, that's fair. That's a good reason too.
I still
let's go and
felt a
get this
little
first
bad.
one here. Yeah, but sometimes Dan is a little silly, which is nice. But sometimes the levity needs to be tempered a little bit.
Mm-hmm.
Okay, I got the first fragment.
I think he's doing great for the spirits and the morale and his light duties and things like that, though. I think it's helping.
No, I definitely agree. I do agree. Like I said, that's why I turned the Dan expendable rule to number 4 instead of 3 now.
What's rule 3?
Sam's first.
Fair. Wait, are you saying Sam's first as in Sam's the company's comes
Hospital.
first or Sam?
The hospital.
Okay, I was
The
about to say
hospital.
Sam is expendable first. It's like, which Sam?
No. No. Sam's the hospital should come first. After no dying and no leaving. Because honestly, everyone here is kind of like family to me. So
It's starting to feel like that to me too.
good. That's what I like to hear. Okay, let me go ahead and get the second fragment here. Can you go ahead and get her skin prepped for the grafts?
Yep.
We're gonna use synthetic skin. I'll get the second fragment out of the nose here, and then I can just double check and make sure the airways are clear.
I just bandaged. This one on her thigh, the
Mhm.
NB, I just had to suture it, so it might need some time to heal before we graft.
No,
I'm not sure.
I didn't graft.
All right.
Yep.
Remove these sutures then.
Go ahead and remove the sutures. We're just gonna cut it clean up the jagged edges. We're gonna put synthetic skin grafts. And then impregnated bandages on top of it just to keep it clean. There we go. All right, let's confirm the septums here have been corrected. All right, perfect. Nice and straight. All right, I'm gonna go ahead and remove the retractors. I'm gonna get her nose stitched up.
Okay. So, how much of a surface area should I cut around? Like,
Just so the jagged edges are gone.
okay.
So not a lot. We don't want to do a lot. The idea is we take out the jagged edges from when they did the carving and the skin split raggedly, right? Because it's not like they were using a scalpel to cut her skin, right? They're using probably a knife, but knives come in various sharpnesses, and unfortunately, when you use a knife to split the skin, it's not a smooth edge. That's
Right.
why we need the scalpel to make it a straight edge. And I could have kept her awake for the septum surgery, but that'd be kind of awkward, right? 'Cause she'd be staring at me while I was doing this.
That
But
would be very awkward.
I didn't want her awake for the stitching and the cleaning of the carvings and stuff.
Mm-hmm.
Her nose is going to be a little funny feeling for a couple of days, but that's okay. She'll be good.
Mm-hmm.
Although she might sound a little nasally, which I will warn her before she talks. She's going to sound a little nasally.
I mean, at least in the grand scheme of things, that's better than having a crooked nose.
Yeah. Some people are kind of bothered by crooked noses. Some aren't.
Yeah, I got mine broke years ago and I never bothered to get it fixed.
We have a second carving on her, right?
Yes.
Okay, where was that one at again?
Not really dumb as a rock, more so
Off the top of my head, I'm not sure.
Nancy, you've been watching her. What do we got? Okay, Brianna on the chest. Okay. All right, I'm gonna get her chest exposed here, and I'm gonna take a look at that carving.
Alright, is it the gauze pad, then the impregnated bandages, or just the impregnated bandages?
Just the impregnated bandages, yeah.
Okay.
Okay, I'm going to chest up, cleaning here with some saline. Let's go ahead and check this carving here on the chest. Let's see what we got. Oh, it looks like Lena's awake.
I just made the realization of why we're using synthetic skin. It's because she's allergic to fish.
Mm-hmm. Okay, chest looks good. I'm gonna get this cleaned up. We'll do a graphic on the chest.
Mm-hmm.
Nice and slow here.
That you can drink on
This is like the first actual surgery I've done in like 2 weeks.
Must be nice to get back in here.
I miss it. Don't get me wrong. I love what I do, but I do miss surgeries.
Anytime I need an assist, I'll let you know.
Yeah, don't hesitate to call me in if I'm around. Unless I'm out with Hazel. Please don't call me if I'm out with
Oh god,
Hazel.
no, I would never.
You can text me, just don't call me.
I try to limit how much I text you when you're off duty because I know that you're a workaholic and I know if I keep texting you, you will probably come in. That's why I save it for either really stupid questions or
Mhm.
something rather amusing.
That's fair. That's fair.
I still can't get over topical nitroprusside.
Yeah, I don't understand where that even came from. Alright, I'm gonna go ahead and stitch on some synthetic skin here under the chest, nice and even. I'm gonna minimize as much of this as possible.
Will there
We'll
still
double
be some
check.
scarring, do you think? Or...
There, because it's synthetic and it's not tilapia, there is a chance there's gonna be some scarring.
Mhm.
It might not be a lot though, to be honest. It depends on her body. So we'll see what happens. That is the one problem with synthetic, is that there's no way to guarantee it's not gonna scar, unlike tilapia, because the body consumes the tilapia while it heals.
That sounds both gruesome and fascinating.
It's just part of the human body. Anything that's foreign, it'll try to absorb.
Mhm.
And there's nothing quite as foreign as fish scales. I mean, there's other things that could probably be like a little bit more foreign, but like legitimately, fish scales are very foreign for being on the body, and it seals the wound very, very well. That's the one really big thing. So, because it seals the wound so well, it allows the body to heal the skin properly, and it's such a quality of life difference.
Mhm.
There we go. Well, she's gonna have a little bit of a bulge on her upper chest, but there's not much I can do about that with the impregnated bandage.
Are we gonna graft the? Actually, now that I'm taking a look, there's some burns on her left thigh. Are we gonna graft those as
Yes.
well?
Yep. Let's get those two.
Okay,
Let's
I can start.
do it all. She's in here. Let's do it in one shot. We'll mitigate the after symptoms of tiredness and stuff. Because she's anemic, I would rather have it done in one area.
Mm-hmm.
Have it all done in one surgery, one visit, so we're not like keeping her down for multiple weeks. I'm sure she'd prefer that too. And if she doesn't, she can whine at me.
So with burns, because it's a different type of trauma to the skin, how much of a space do I leave around it?
Little extra. Make a little extra.
Okay.
Yeah, I do roughly about another centimeter, give or take a little bit. A centimeter all the way around. That's plenty. That's plenty large enough to very easily stitch onto number one healthy skin. Just in case there's still some scorching, right?
Mhm.
The other thing is it allows the graft itself to take to the healthy skin, and that's
Makes sense.
very important. That's very important. Okay, I got the chest all taken care of.
Okay, there we go. Okay, this part is ready for the graft.
I'm gonna go ahead and check vitals. I mean, we're not doing anything too invasive, so she should be pretty good.
So what did you do on your date?
So we went to the bowling alley. And we tried to get the lowest score we could instead of the highest without going zeros.
That actually sounds pretty fun.
It was actually. It was a lot of fun. To be fair, I was a bit
Hey,
distracted.
Bobby. You want to go for a
I'm
ride?
sure you saw her when she came in.
I didn't actually.
Oh, she was wearing this really short skirt with high-waisted panties that were pink, and a bikini type top with ties in the back. It was kind of hard to concentrate, honestly.
I'm
kinda
gonna choose my next words carefully so
Uh-huh.
you don't throw a scalpel at me.
Okay.
That does sound very distracting.
She's hot. Okay. It's fine, Benji. It's fine. She's incredibly attractive, and I don't know what it is, but there's some kind of spark between us I can't describe. And it's kind of surprising because I was married, right?
Mhm.
I didn't feel this with my wife. So it's thrown me off a bit.
And there's loads of other different types of love.
I should talk to Kia about took
There
her
is.
advice when she's done there.
There is. There's a lot of different types of love, but this one feels more real.
Mm-hmm.
And I think I actually am falling for her.
Aww.
It's
Alright, I'm done with this. I think we're good.
okay. I'm just waiting on the vitals check here.
Mhm.
Let me just check the machines real quick again. I don't know. My daughter and Indy really want me to go be with somebody else, and I don't know how to tell them I don't want to.
You just have to tell them. I know it's gonna suck, but
Yeah, it's not that easy, Benji. You
I
don't
know.
understand the history. Okay. The vitals are good. All right, if you're done, let's get her over into recovery and get her unsedated, my dear.
Alright, let me get these vitals monitors detached.
Yep.
And 3, 2, 1.
Here we go.
I don't think I'm going to get much of a chance to do this. So since you've missed surgery so much, you can write the surgical report.
Done.
These fucking doors. There we go.
Oh,